Hello everyone and welcome. My name's Sarah Murphy and I'm a development worker for Infertility Network Scotland. I'm pleased to see so many of you here to find out about such an important and unreported topic. And just to clarify, it was actually around lifestyle choices and fertility or infertility. Infertility affects 1 in 6 couples in the UK, and this figure could be up to 1 in 5 in Scotland. Infertility Network Scotland is the largest charity supporting people with infertility in this country. We have over 2,000 members, 12 support groups across Scotland, and dozens of support groups across the UK. So why are we here and what are our aims? Well, the numbers, as I've just said, suggest how widespread the problem is, and people are always shocked by this. But why are people shocked by this? Because as a nation, we don't talk about infertility. It's a taboo. And because it's a taboo, there's a vast amount of people suffering in silence, and there is a vast amount of people who are uneducated about their fertility. So, the result is a population of people who are having to resort to treatment because they're ill-informed about how to protect their fertility. We also hear the most common complaint for people undergoing fertility treatment is a feeling of complete isolation because we don't talk about infertility. Okay. Infertility Network Scotland are aiming to address these issues. Firstly, this year, on our 10th anniversary, we're launching our campaign Talking About Trying, and you'll find literature at your seats on how you might be able to help us in our mission to end the secrecy and isolation that people feel. And to create further awareness, we're following the states in their more open approach to infertility and their well-established Infertility Awareness Week by launching our own, which will be between the 28th of October and the 3rd of November. Again, please read the literature for more information. Finally, and most importantly, we're trying to educate people about their fertility in the hope that fewer people will need to resort to expensive and extremely stressful medical intervention. Dr. Martins da Silva, who's with us now, has kindly agreed to talk for us today as part of our education project, which aims to make us think about our bodies, our choices, and our reproductive health. Dr. Martins da Silva is highly experienced in the field as she works as a consultant at the Assisted Conception Unit in Nine Wells, as well as being part of an active research group at Dundee University focusing on male infertility. Dr. Martins da Silva will explore with you today the current research around lifestyle choices and fertility. Her talk is research focused and aims to give you the evidence that exists surrounding this subject. Following the doctor's talk, I'm then going to read to you a real life experience of a patient who has actually travelled this journey. Because when we talk about the science, it can be easy to forget the real story of those who are struggling to have a baby of their own. So I'd like to welcome Dr. Martins da Silva.
Firstly, I apologise for my tardy appearance. Goes to show you should never trust a sat-nav. I ended up in Monifeith in Tay Street. Thank you for that. So I apologise for starting late, but I'm really delighted to be here and very grateful for the opportunity to chat about fertility and lifestyle. Now, as Sarah's already mentioned, I'm a consultant gynaecologist based at Nine Wells Assisted Conception Unit. We're one of 4 centres in Scotland offering IVF treatment. So there's also Aberdeen, Glasgow and Edinburgh. And on top of those 4 NHS facilities, there's 3 further clinics where purely self-funded private treatment is undertaken 1 more in Edinburgh and 2 further in Glasgow. So in Nine Wells, we have patients that feed in from 4 different health boards. We have our own Tayside patients, obviously. We have patients referred in for tertiary care from Fife, Forth Valley, as well as the Western Isles. And up until very recently, we had 4 different criteria from each of those health boards in terms of the patient's eligibility for NHS funding. So all of them had different criteria, they all had different waiting times, they were offered different cycle numbers, either 2 or 3, and different consideration was given to whether they self-funded treatment whilst they were waiting, in other words, reducing a cycle of NHS-funded treatment. So quite frankly, it was a bit of a nightmare trying to keep on top with who was quite eligible for what. And I'm really delighted to see this year that there's been a unified group eligibility across all health boards in Scotland, which is to be applied before each cycle. And also on top of that, with the Scottish Government funding initiative, we've seen a significant reduction in waiting times both for commencing treatment but also between treatment cycles. So the bottom line is the criteria that are now set are that a patient should be under the age of 40 at the embarking of treatment. Different health boards need to be 38, 39, 40, 41. They need to have a BMI between 18.5 and 30, which has been reduced from a BMI of 35. Both partners need to be non-smokers for at least 3 months before treatment and during treatment itself, and the partners and couples will now be tested in advance of treatment. The couples now are only eligible for 2 cycles of treatment. It's probably the most controversial change that's been introduced. With those couples where there's no explanation found for their infertility, the duration of trying for pregnancy has been reduced from 3 to 2 years. And as previously, they had to have no children living in the home and no partner to have previously undertaken sterilisation. The raw facts are that IVF treatment continues to rise in this country. Year on year, since HFA records begun, we've seen between a 7 and 8% increase in treatment cycles. Overall, our live birth rate is now 25% compared to 14% in 1991. The majority of the treatment is self-funded, with only 40% of cycles in the UK being NHS funded. But since 1991, 2% of all babies have been born as a result of IVF treatments.